Osama Blay from Al Haqiqa Dawliya channel. We're happy that mosques and places of worship have opened their doors before worshippers, and we're happy at the successful process of the Ministry of Awqaf. My question, however, is about the Quran schools. We know that this is the best time for children to go back to memorize Quran and to pursue their religious activities. So to what extent are you going to study and consider the reopening of these centers, the Quranic recitation and Quran memorization centers? All of these kinds of institutes, colleges and schools will be open once we hit the green alert code, and then we'll reopen centers and Quran recitation schools. But now, unfortunately, we cannot, because they entail gatherings, and they entail having many people in physically present in one place. When is it possible for us to restore our normal life without the defense law, according to your D matrix? The defense law was not a luxury, by the way. The defense law was necessary because there are things and decisions that you can only take with the presence of the defense law. We really look forward to resuming our normal life and repealing the defense law once we are back to normal, and once the pandemic is over. Of course, we will repeal the defense law. We look forward to this as much as you do. You mean the situation in Jordan? In Jordan and elsewhere, and in the whole world. Good afternoon, Mahmoud Tarawne from Al Ghad newspaper. My question is addressed to the Minister of Health. Have there been exceptions? Have there been people who were allowed to come to Jordan without being placed under quarantine, like from Yemen and elsewhere? And what measures have you taken in order to deal with this situation, especially people coming for medical treatment? Yes, since day one in the pandemic, and we had a meeting. And for the diplomats, Jordanian and foreign diplomats, of course, they are dealt with on a reciprocal basis. We decided that those who have diplomatic capacity, those people will not be quarantined, will not be placed under quarantine, and they will be quarantined in their own embassies. This applies to Jordanian diplomats in foreign countries. This, of course, is reciprocity. We're only notified that these people came in, and we follow up in order to ensure that they are being quarantined in their own embassies. Unless somebody complained, then we'll send a team in order to ensure that they are being quarantined for 14 days. And like I said, this is according to international customary law and according to and on the basis of reciprocity. The National Council for Crisis Management received requests from Arab countries, friendly Arab countries and other friendly countries, people wishing to come to seek treatment, medical treatment in Jordan. For that matter, of course, they communicate with the National Council for Crisis Management. The council examines the cases. Of course, they have representatives of different ministries seconded to the council. We have our own, mostly they are cancer patients. Of course, we impose our health requirement. We isolate them in hospital at Al Hussein Oncology Center, and also in the hospitals which have this ability. Our team goes to check them if they test positive, like in 2 cases from Arab countries. If they tested positive for COVID-19, we take them as per the law to Prince Hamza Hospital. But like I said, these are humanitarian cases. In their regard, there have been a coordination between the Ministry of Interior, the Ministry of Foreign Affairs, and the National Council for Crisis Management. Our duty is to deal with them from following the protocol, isolation and examination. Based on this, protocols are being developed, including several security and departments and ministries, aiming at restoring medical treatment tourism so we can maintain in order to improve our economy and to help our friendly countries who seek treatment, because you know that the hospitals of our friendly countries are packed with patients. So there are several things that we considered before taking decisions, but like I said, these are few cases, mostly for Al Hussein Center for Oncology, and a few cases came based on diplomatic requests, high-level diplomatic requests, and we deal with them as patients. And by the way, there are few, less than 50. Peace be upon you. Hamza Abu Rumman from Al Wakil news site. You say that you only allow one question, but in fact we try to represent to voice the opinions and concerns of citizens. This is an exceptional situation. I hope you can bear with us. I'm not sure what to ask. In fact, my question though is addressed to the Minister of Health. You mentioned that Jordan has a high rate of recovery. Do you still use hydroxychloroquine? And since there is no treatment, on what basis did you consider Jordan to be among the countries with the high recovery rate? Hamza, I would like to say that our colleagues, the journalists, can always contact us, and they call me over the phone, myself, my colleague, the Minister of Health, and Mr. Faraya. We are bound by time here. This is why I allow, and always we allow, and we always answer questions of our individual colleagues, the journalists, over the phone and whenever you wish. But during the press conference, we only allow one question. We would like to thank you. We would like to thank the armed forces and all ministries. We don't want to burden you, but in fact, yes, citizens as well have lots of concerns. We'd like to voice that. We're at your service and at the service of citizens. Well, this is something statistical. Since day one, there is a scientific committee to develop a treatment protocol. The treatment protocol includes hydroxychloroquine and other medications, including vitamins. There's no one medicine. We started using hydroxychloroquine since the very beginning. Even when the WHO issued a report saying that it's not useful, then 2 days later it said, no, it is useful. We did not stop when it said that it was not useful, because we know that there is lots of controversy in the medical field, and it's normal, by the way. So we continue to use this medicine. It's an optional medicine. We inform the patient that we're going to give you this medicine, and we do the testing in order to ensure that they do not have any problem with the heart rate, with the palpitations. The recovery rate is high, well, because the number of cases is low, and because we take them at an early stage, like we give them vitamins and we keep them away from fatigue or stress. or pressure. So this might be an explanation, but there might be no explanations. It's a statistical percentage. We are 71%. Like the recovery rate is 71%. The only higher rate is 72%. Why do we have a high recovery rate? There is no one answer for that. Aya Al-Ja'bari from Al Husna radio station. My question is addressed to the Minister of Health. Is it clear why do you know the reasons for the infection of the dentist? Did he receive this, did he contract this infection from other medical staff? And is the government going to reconsider house quarantine? So you combine several questions in one. Yes. Six cases are the contacts of this person. The dentist, it does not work in the public health sector. He has his own practice. It was closed down in order to isolate it. And of course, we took all the preventive measures. 3 of his family members, 6 of his family members are COVID-19 positive. Till now, we don't know the real source of the actual source of the infection, but I reassure you, the cell working on this are not sleeping. They are staying up all nights, and he has so many contacts, and we're going to all of these sites. And now with the reopening of industries, it's very, very hard to get to every one of his contacts. And I'd like to invite everybody to download a MAN application. Had he downloaded this, we will receive a notification as to everyone who was around him. And this is why we invite everybody to download this application, please. It really helps us. It protects us. It protects us, rather than having to ask him to remember all the contacts he met with. If you ask me who did I meet 3 days ago, I might not remember. This is why we would like to invite everybody to download this application. As for the house quarantine, well, this is our last resort, because in Jordan, our people don't commit to staying at home and complying with the requirements of house quarantine. Abdul Hakim Al-Garale from Al-Ra'i newspaper. My question is to Dr. Saad Jabir about recoveries. Is there a specific number of people who were infected? And is there a program by the medical staff who that helps them follow up the patients who recover and who are released from hospitals? We did not have any patient who was reinfected or who, what happened is that in the lab, we test a person, he would test negative, then afterwards they will test positive. Why? Because the virus will have decomposed into smaller particles. These smaller particles will run in the bloodstream, and when you retest that person, they would test positive because of these particles, not because they are sick, nor does this mean that they are infectious. We had 6 or 7 cases who tested positive after having recovered, and and this is, by the way, not specific to Jordan. This is something being seen throughout the world. What's the other question? Yes, we have a team who follows them up. We call them and we give them a promissory note to sign, promising to stay at home. We give them our phone numbers. We call some of them, especially those whose situation was not really good. Not all of them, 50% of them. Remember, this is lots of work to do, but we follow up with them to the extent possible, because we have so many people who are released from hotels, and some of our teams call them in order to ensure that they are being compliant with the house quarantine and so on. And we're negotiating with a party now who is going to take over this function. And now we have an application, it's called Badr. A person released from the quarantine will not be allowed to leave the quarantine unless they download Badr. Of course, this follows them up and ensures that they do not leave their houses at all for 14 days. This is for your own good, by the way. My question is from Al Mamlaka channel. You're talking about the tourism sector, and you're saying that we're going to launch plans and tourism programs. Does this mean that we're going to stop using hotels for quarantine? You know, that we have hotels and in Amman and in the Dead Sea for quarantine. Our focus for our touristic programs is going to be on the south, Fatra and Aqaba and these areas. But for the future, the hotels in the Dead Sea, because this is a very important touristic site, the hotels are not going to be used, may not be used for quarantine, and we'll have the hotels in Amman use quarantine. We're talking not only about hotels in the tourism sector. In fact, many workers in the sector, including tour guides and others, all of them are impacted by this. I'm going to call for a press conference where the Minister of Tourism is going to talk about the details of this touristic program that we're going to launch. Thank you very much. Hi, my name is Hadil Ghaboul from CNN Arabic. My question is of two folds. Everyone is talking about the second wave of COVID-19. Does the government have a plan to prepared for this wave, and do you have any preliminary indicators to forecast the time of this second wave? You talked about your Excellency, the Minister of Health, talked about the medicine you're using to treat COVID-19. Has this medicine been used with the 9 deceased cases of COVID-19? The 9 deceased persons did not take this medicine. And by the way, 5 of them died out of the hospital. They are elderly and they died out of the hospital. And we found that they have COVID-19 because, according to the current instructions, any deaths that happens before arrival to the hospital has to be tested for COVID-19. And this is what we did. And burial cannot take place unless this test is conducted. So none of the deceased has taken hydroxychloroquine. And as for the pharmaceutical studies and the studies of the treatment for this COVID-19, what you do is that you have a control group and a test group. You study that for a period, and in order to have a valid finding, you need to have statistical analysis, and you have to analyze the data in depth and analyze the differences before you conclude with something that you can confidently share. And you know that there is lots of controversy in regards to this treatment. This treatment is something we used since the beginning. We're still using it. We haven't seen any side effects unless in 2 cases we stopped it once we saw the side effects and they were not hurt by the medicine. And we have a study joint between the Ministry of Health and Jordan University and Jordan University for Science and Technology. We're studying this, and that will take a bit of time. About the second wave, everybody is saying first wave, second wave, and third wave. Well, I really hope, as a person, as a physician, I hope that there will be a vaccine that will appear before we see a second or a third wave. we cannot predict when the waves are going to come. And I'm not even sure if what we saw was a first wave or a second wave, or was it just a number of isolated cases that we were able to control before they become a wave. However, our epidemiological situation is good. We need to control it. The most important thing is to control border posts and to follow up cases in the country in order to ensure that infection does not spread, especially in the context of the reopening. Do we have valid predictions? No valid predictions, no valid forecast, and nobody can actually come up with these forecasts. Good afternoon, Niveen Abdel Hadi from Ad-Dastur newspaper. My first question is addressed to the Minister of Health, Idris. How can we maintain this achievement that we have made with the reopening now? We can see that there are thousands of people crowded in same area in these in some areas. How can we protect our health situation? And is there a place or an entity to which the citizen can report any case that is in violation of the law, especially that in the private sector, female workers are made to report to go to the workplace even if they have children. My question to Mr. Faraya is about the possibility of giving me the number of persons who departed Jordan. We know the number of people who were repatriated, but not the number of people who were deported or who departed the country. He will answer you after the meeting. Now, how to maintain this achievement? I would say every Jordanian citizen, just like mentioned by my colleague, and everybody knows this. The journalists are writing about this. Now we told every citizens, now it is a joint responsibility between the government and citizens. Every single child in Jordan, everyone, even children, know what they should do in order to safeguard their health. Masks, physical distancing, washing their hands, these measures that we do not need to repeat now. Physical distancing is most important, not to be in crowded areas. Everybody knows this. We told the elderly not to go to mosques. Even when you go to mosques and churches, we took our own praying mats and kept distances. So this is a model Jordan has set. Everybody knows this. The citizens know, everybody knows, and this is our duty to maintain this achievement. The best thing that happened is that people went back to their work, daily wages. We will hurt them if we are lax in dealing with the situation, and if we don't comply with preventive measures, there will be another outbreak and people will not get to work and make any income. Everybody was calling for the reopening of industries, but now the enterprises owners need to take responsibility and ensure compliance with preventive measures. And who to report to and who decides? Of course, the state. If the preventive measures were not complied with, if there are violations for health measures, this is a challenge, then the state will make people comply in order not to regress. All of us are accountable. The media is accountable as well. You're our partners when it comes to awareness raising, and you have that responsibility. Sam Al-Abbadi from Hala Akhbari, the Minister of Health, you talked about 6,650 samples you tested today. Are they targeted samples? Because at some point the tests were targeted to targeted contacts. And do you have labs that you stopped working with because of their inaccuracy? And are the stocks of the Ministry of Health enough to cover the testing needs. The 6,650 tests conducted is done methodologically in order to upscale testing. When you reopen industries, you need to upscale testing. Since the beginning of the pandemic, we asked for test kits and new kinds of devices. So now these started to arrive, and therefore our capacity is increasing. Tests are targeted and random. For governorates, there is a quota, and in governorates where there are no cases registered, the testing is random. Up to 60 to 70% of the testing is random, 30% is targeted. But we call this dynamic testing. For example, we received 3,000 repatriates, then we need to focus on them. 2,500, for example, 2,500 people are being released from hotel quarantines. We need to target. So this is dynamic. It's up to the situation and the number of repatriates and so on. And yes, we are still in cooperation with the private sector. The test accuracy is very high and the precision is high. What we do is that we test the private labs. We send them tests. We know that these are positive for COVID-19 and we test them. They know this, and I must say that their accuracy is very high. It's 100%. And in fact, if any of them violates the preventive and safety measures, they are warned by us. And this is my answer. There's one lab that was closed because it was not licensed, and one lab was warned and we suspended it. But the rest of labs, they are very highly reputed, well reputed. Ayman Sawa'i from Al-Anbat newspaper. I'm asking about this. Is it true that you halted the lockdown just for the sake of economy, and then we'll resume the lockdown, that you just reopened for a couple of months and then we'll restore the comprehensive lockdown? It's not clear. Some are calling for imposing defense order number 11 because people are not complying with preventive measures on markets. My first question is this: is the reopening done only for the purpose of allowing the economy to revive for a couple of months, and then we'll go back to the comprehensive lockdown? We reopened industries because of this, because the pandemic is under control based on scientific studies that we have, similar to scientific studies other countries have. If we have cases, local cases less than 10 on daily basis for 7 days in a row, most of the cases that were detected were for people coming from abroad. So the pandemic was under control. Therefore, we decided to reopen more industries. And of course, the other reason is that some industries were negatively impacted and we needed to restore normal life for these industries. But like we warned again and again, and we still warn that, God forbid, should the number of cases increase and should there be a burden on the health system because of this pandemic, we'll restore the policies of comprehensive lockdown, partial lockdown, and shutdowns. This is what we're saying. The pandemic is under control now, but should the number of cases increase, we will definitely restore the lockdown and shutdown measures. It is dependent. The whole situation is dependent on the epidemiological situation. According to the recommendations of the Ministry of Health, we take decisions. The situation is under control now. Defense order number 11. There are demands, so many demands. When we need a defense order to correct any situation or to support any industry, then we will issue a defense order in that regard. Till the date, there's no specific defense order needed to address a certain issue, a specific issue, but will there be more defense orders? There will be. But for now, we do not have an idea about the nature of these defense orders and in regards to what issues. There are demands coming from citizens, and the government does have an idea and a plan as to the things that we're going to work on and issue defense orders in that regard. In the end, I'd like to thank you very much, and I would like to apologize for the people who I was not able to take their questions, but we needed to keep track of time. Thank you very much for your attention, and you're most welcome always.